Hello everybody and welcome to the COVID Camper. This is Dr. John Blanchard from Michigan. I'm a family physician here, and today is April 30th. It's day number 37 in the camper. I'm glad to say that the numbers have come down quite a bit in Michigan, and we continue to decline in the number of cases. At Beaumont Hospital with our admissions, we're at about 600 now, and we had peaked at 1,200, so there's also a decline in hospital admissions. I want to emphasize that that this decline has been because of the quarantine, and I think everybody really needs to be congratulated about that, and the numbers would have been extraordinarily higher had the quarantine not happened. There's still a lot of people on the internet talking about COVID not being as dangerous as influenza, and that the quarantine wasn't necessary and those types of things. Every area of the country is a little bit different, but certainly here in Michigan, the quarantine really prevented, I think, a catastrophe. And everyone should be commended for following the stay-at-home order, and hopefully it looks like mid-next month, mid-May, the quarantine will be lifted. I want to talk a little bit about what to expect when the quarantine is lifted. I want everyone to know that we've learned a lot about this virus. One thing that we've learned is that it's much harder to contract it when from the air than it is from touching something with your hand and then touching your nose or mouth. So when the quarantine is lifted, it is a good idea to wear a cloth mask when you're out in public, maintain 6-foot distance, wash your hands when you come home, use hand sanitizer when you're out. Still practice those good hygiene measures, and that'll really reduce the likelihood of you contracting the virus. We also know that warmer climates, UV radiation like sunlight, really kills the virus quickly, and it has a hard time surviving in that environment. So coming into the summer, I think that should really help us as well. One of the things that I want to talk about is that a lot of people have put off medical care during this time, and if you have chronic conditions like diabetes, hypertension, high cholesterol, those types of things, if you've had health problems going on, it's time to start thinking about getting back to going to see your doctor, making sure that you're getting that yearly physical, the yearly comprehensive evaluation, attending to your chronic care needs, seeing your doctor for the routine, or urgent type of visits that you need to see them for. And when you go to the doctor, in the doctor's office, they should have protocols in place where you have social distancing, wearing a mask, able to keep 6 feet from each other. They shouldn't have really crowded waiting rooms and that sort of thing, having less patients in the office at one time. But there is growing concern that people have been putting off things that they should attend to with their doctor because of the quarantine, and that could increase the risk of problems going forward with people. So I do think it's time to begin thinking about that. One of the things that I really hope comes out of this experience, as we've talked about in the past, is mindfulness, and this idea of identifying when we're falling into thought distortions. And the thought distortion I want to talk about today is one of the most common by far, and that is mind reading. Mind reading is the thought distortion that we think we know what other people think of us or what they're thinking of us, and we don't. We imagine what they might think of us, and usually we imagine it in a way that they're critical about the way that way we look or the way we act, or any number of things that we think that people may judge us about. So we've got to be really careful about falling into mind reading thought distortion, and think clearly about that we truly don't know what other people think, and so we shouldn't fall into that, and really look at what people say, how they act towards you. Don't imagine what you think they think of you. That's an important thought distortion. One thing that I really love about being a direct primary care doctor is that I hear a lot of complaints from people that in the traditional healthcare setting, it seems as if they can never establish care with one doctor. They either choose a doctor and then they go to that office, and it seems like they see a different doctor each time, or a provider like a PA or nurse practitioner, instead of having a continuity of care relationship with one provider. I think this is incredibly important for healthcare, that a trusting relationship forms between a doctor and their patient, and that the patient knows that the doctor cares about them, knows them, and they have this long-term relationship. We also hear patients talking about that they have to change doctors because their doctor is no longer in their network, and that creates fragmentation of care. We think that there should be a long-term relationship with the doctor, and that's what we offer at SALTA Direct Primary Care. So that's how direct primary care works for me. If you want to see how direct primary care can work for you, give Kyle a call at 248-922-3076, or check us out on facebook.com/SALTA of Clarkson or facebook.com/SALTA of Troy. That's it for today, and I look forward to doing another video next week.